My name is Sandra. I'm an OT and a faculty member in the School of Rehab Science at McMaster University. And they asked me to talk a little bit about some of the work that we've been doing with healthcare workers and supporting their mental health. And so thank you for this opportunity to talk a little bit about the kinds of things that we've been thinking about and doing around technology and how do we better support frontline healthcare workers. And I thought I would start by just sharing, this is not a study, but I'm not sure how many of you get the Globe and Mail, but there's this very powerful 2-page spread in the Globe this week that had sort of excerpts from journals called Dispatches from BC's Frontline. And I just took a couple of excerpts here because I think it really speaks to kind of the human element. John has done a beautiful job of highlighting some of the stats, and I'm really a qualitative researcher. So again, the stories I think can also be really powerful. And so I just took a few that kind of illustrate to me a little bit about some of the things that people are experiencing. So the first one here is around some of the physical and mental labor of using PPEs and the challenges of actually putting it on and taking it off, and the fear I really associated with doing it properly and contaminating myself or potentially others. And then some of the pieces around people being isolated and alone from their families and the emotional toll that that can take. The next quote is from a paramedic who talks about this idea of a moral dilemma. And the challenge is, I think, you know, when you're a frontline healthcare provider, you want to provide the best care you possibly can. And sometimes there's just a disparity between what you can do and what you must do. And that really being a cause of mental injury for frontline workers. And the next quote about the page is really about the virus itself. So, you know, this is a really deadly virus, and people are doing the best they can to save people, and sometimes it's really, really tough. And that can have a huge toll, I think, on people whose job it is to save people's lives. And then the last quote I think is really powerful because, you know, we know that many frontline workers are working many shifts. That's really tiring. And they talked about this idea of COVID fatigue. So, you know, when something first happens, there's this adrenaline rush. Okay, let's mobilize ourselves and let's try to do the best we can to deal with it. You know, this is not a situation where there's an end. It's lots of uncertainty about, you know, is there going to be a second wave? And the uncertainty, I think, also takes its toll on people. So how do we keep up this level of preparedness over time? So I think, like many of us, we've been reading the newspapers and trying to think about how can we respond? What can we do? How do we better support the frontline workers? And so I've also been thinking about that as a researcher. And just to give you some background, for the past 10 or 15 years, a big part of my program of research is how do we better support the mental health of healthcare workers? And so it's led to this stream that I call Beyond Silence. And we named it that because many healthcare workers are reluctant to reach out for help. This is pre-COVID. At any point in time, they're reluctant to reach out for help. And so there's often a long lag time between the onset of mental health symptoms and people seeking help. And so much of my work has been, how do we move the bar earlier? How do we promote earlier intervention and support? Because we know if people get help earlier, they can recover faster. There's less consequences for the workplace, for themselves, for their family members. So some of that work has been, you know, can we do a better job of creating spaces for people to talk about mental health issues in the workplace? How can we reduce stigma? And so we developed a training program, a workplace training program that is led by peer educators, so healthcare workers who personally have experienced mental health issues in the workplace, to start to open a conversation and to give people tools and strategies for talking about mental health issues, reaching out to support themselves, but also for colleagues. So some of that work we've done a randomized clinical trial over the past 2 years. We got funding from the Ministry of Labour to roll out the program to across Ontario, looking at smaller under-resourced organizations. One of the things that we've learned is that although the program is really good, it's effective, lots of great things, not everybody enrolls in a 2-day workplace training program. The people that do really get that this is an important issue. They're already the educated people. So it really started to get us thinking about how can we reach the people that don't come to the programs? How can we leverage technology maybe in some way to kind of scale up that information sharing and to engage people that may not enroll in a program? So that began our journey into app development. So back in 2017, we were fortunate to receive some funding from CIHR to basically develop and pilot test a smartphone app that promotes mental health literacy and mobilizes healthcare workers to seek mental health support for themselves and their colleagues. And so we said what we wanted to do is focus on small or under-resourced healthcare organizations, that many of the large organizations already have infrastructure, they have programs and supports in place. So who is not getting those? And can we really look at who is most at need and target our focus to that group? And so what we came up with is called the Beyond Silence mobile app. And really the goal was to create an online evidence-based information and support tool that's really customized for healthcare workers specifically. And we wanted something that would reduce the stigma of seeking help, to increase access to high quality information and support, again, particularly for those small under-resourced areas. And the idea of an app is it can provide 24/7 on-demand assistance, so the information and support that you need when you need it. And so this is our journey of app development. It actually doesn't look this linear. It has many twists and turns, and I am not an app developer, so lots of learning along the way. But essentially, we've gone through a number of different iterations. We had an advisory team representing some of those smaller under-resourced workplaces to help us along the way to really try to design something that was by and for healthcare workers. And so we've done some beta testing I'll talk about, and then we actually have just launched the app. We're very excited. This is the first time we've spoken publicly that it's actually been available, and I'll talk to you about that. So, oh, you know what? I probably, when I shared my slides, I'm just thinking our tech support person, I'm not sure if this is going to play. This is a 2-minute, can you hear that? Can you hear that? Sorry.
Yeah, we can. It's a bit distorted. If you go up to that share, I think you'll be able to change the optimization in the top. Oh, you can't. I think it's okay. Try it.
Okay, I'll try it. It's a 2-minute. We can send the link afterwards. My apologies.
The Beyond Silence smartphone app was developed with input from healthcare workers in a range of small to large organizations with the goal of providing accessible, high-quality, confidential information and mental health support when and where you need it. The app has 3 main pathways: information and support for yourself, strategies to support coworkers, and links to a range of mental health services and supports. There is a check-in feature that helps you get to the information that you need, and there is an opportunity to track your wellness as well as set goals and link to a peer mentor. Once you enter your access code, you are not asked for any identifying information, and the data on your phone is completely private. At McMaster University, we completed initial testing with healthcare workers across Ontario. They let us know that the app was easy to navigate, provided relevant information that was tailored to their needs, helped them to feel that they were not alone, inspired them to set goals for change, and was a gateway to relevant resources. We feel the app works best if it is available to all employees in an organization. There should be at least one mental health champion who we can link with to customize the app for your organization, since we can set links within the app to your internal policies and local resources. We will support the champion to communicate with employees about the availability of the app and how to access it, and the champion can link with our team if there are questions or concerns. This mental health coach in your pocket is an accessible, evidence-based resource that is available to employees when and where they need it. It increases mental health literacy and promotes a psychologically healthy and safe workplace, which can lead to increased morale, staff retention, productivity, and quality of care.
So that's voice is Lisa Wolf, who's our wonderful project coordinator, to put together kind of that information video. And what we tried to do with the app is a few things. So this is what the check-in, the sort of the landing page looks like, and there's different ways that people can access the app. So you'll see that thing that says, how are you doing, good and not so good. So you can kind of go through this chat bot to get to the information you need. You can search specifically for relevant information. So I'm really interested in stress, so you can search for that. You can tap here for help, which actually leads you to a pathway to get to resources. And then you'll see the icons along the bottom or around again, accessing support, setting goals, and there's a wellness tracking feature. And I think I have, yeah, so this is just a visual of what the pathways look like. So, you know, what do I need help with? I need support. What kind of support do you need? I'm stressed, I'm anxious. And then it says, sorry to hear, how bad is it? And then it'll eventually get you to these articles. And so the articles are basically just information. We try to customize it to healthcare. So, you know, something validating that, yeah, this is difficult, you're not alone, and some resources or strategies that they can try, and links to other resources. And then there's a feature that you can set goals. There's a wellness temperature gauge, and there's this other feature around a peer mentor. So an app does some things, it doesn't do everything, and we had this idea that perhaps the app could link you directly to someone that you could speak to that could provide information and support. So that's another feature of the app. Just a little bit about some of the background. So we, with the prototype that we developed, we did some beta testing with healthcare workers. We asked them to participate in testing the iPhone app for a period of 4 to 6 weeks. And we did pre and post surveys to track the impact on mental health literacy, stigma, and health outreach. And we also asked them to give us some feedback about the quality of the app using this Mars app evaluation tool. And we also did some focus group discussions to kind of get their input. And this just tells you kind of who we engaged. We tried to get people from different healthcare organizations, people with different roles, so people in clinical positions as well as non-clinical positions, manager as well as frontline workers. What's interesting is that people use apps in very different ways. I bet if we were to do a poll here, some of you are maybe app lovers, you use them all the time, some of you don't use them at all. So again, we were interested in sort of how do people use it. Some people said, oh, it was really interesting. I played with that at first and then I didn't pay attention to it. Other people accessed the app sort of when they needed it. Some people said, I used it at the beginning of the day or at the end of the day. We had one guy who says, every day I start my day with the app and I end the day with the app. I would say he's maybe an outlier. But again, there's variability in how people use apps. And I'm not saying it's the be all and end all, but it's one approach. And then we did find, even with that small group, that there was a statistically significant improvement in mental health literacy. So that's knowledge about mental health issues and what to do. The other ones, there wasn't really a change. There was a trend, I guess, and people more were likely to reach out to provide help to others. The app has a pathway that's getting support for yourself, but there's also a pathway for reaching out to support others. So it gives you strategies if you're concerned about a coworker. We did some analysis, we did some focus group feedback, but also through the Mars app evaluation tool, and asked about various features of the app. So in terms of engagement, people said that they felt more connected, which was really interesting. And I think in this time of physical and social distancing, people feel isolated. So the app, for some people, really was a way of feeling more connected. Some people liked some of the features of the app. People felt that the information was relevant, practical strategies. Really important piece is people found it really easy to use, very user-friendly. In terms of impact, feeling you're not alone, someone commenting that sometimes, you know, as a healthcare worker, you focus very much on supporting your patients and sometimes lose the focus on supporting your colleagues or even yourself. And so from that feedback, we did some improvements to the prototype. And so where we're at now, we made a decision that we thought, you know, an app we wanted to have it be available to organizations. And part of that decision was, I think, if you have a champion, that might improve uptake. So that for an organization, if they have a champion, they're the ones that can communicate to people about the app, answer questions. With the app, it's really one of the great features, I guess, of the app is we can change the back end very easily. We have a feature where we can customize it to an organization. So we can upload internal policy documents, links to EAP, local resources, local peer mentors, so that the app is a look and feel to be relevant for that organization. We say we want to provide support for implementation. So again, ideas for sharing information with your employees on how to support that, or if you have troubleshooting with the technology, to do that. We're very excited that the app is actually now available in Android and on app. You can download it. So you can download the app, but what it is we give you an organizational code for your employees to access. So that's how you get the customization piece. So anyway, we have the app, it's there. We started to think about, now we're in this whole new world of COVID, and it's really prompted us to think about, we have this app, what would it look like if it was a COVID related resource? And so I reached out, John talked about that Ontario COVID-19 mental health network of basically therapists who are offering pro bono services to healthcare workers. I emailed her and I loved her response so much. I said, I'm going to put it on a slide. But I was really asking her, first of all, could we link to their resource through the app? And she said yes. And I also asked her sort of what are they hearing on the ground? And they talked about this crippling uncertainty and stress. And some of the research that John alluded to from Wuhan saying that more than 50% of frontline workers are now clinically depressed due to lack of support, lack of PPE, a sense of betrayal by those in authority. And talked about, can we provide access to supports now and on the other side of this? And how do we overcome this culture in healthcare where people don't seek help for themselves and don't know how to find help? And so how do we destigmatize that? And then the last line, which I put in bold, is if we're not getting people support now, we'll see another pandemic of depression, PTSD, and somatic issues among frontline healthcare workers. And so how do we better support that group? So we started to look at our app now with a bit of a different lens. So right now, the pathways to support for yourself, you could say I'm stressed or anxious, I'm tired, I'm down or discouraged, I'm upset or angry, I'm scared or feeling unsafe. And then what the app does, it sort of says, how can I help you today? So then you click on one of those pieces and then it says, well, something like this must be really difficult. I have some ideas of what might be helpful. Choose something that might be helpful to you, because different things work for different people at different times. So there's always a choice. So let's say I click I'm stressed and anxious. It'll say, okay, here's some things that might be helpful to you. So I could click on assess my stress. I think the OCOW survey is in there. I could click on breathe, which would give me some immediate strategies, recharge, set boundaries. And again, you'll see the names of each of the, so there's like about 4 choices. And we can think about, or would it be specific COVID related topics? So I think about, I'm scared or feeling unsafe. Maybe there's some links to how do I access PPE, or how do I don and doff them, or, what would that look like? So again, thinking about how do we then change or refresh the articles to be COVID specific, because I think what you want an app to do is really speak to people with what it is that they need at that point in time. So what we've been doing is collecting, trying to collect high quality resources that we could link to within the app. I know PSHSA has some guidelines for treating patients. So for example, long-term care homes or hospitals, guidance about accessing and using PPE, links to policies. There seem to be new directives. on a regular basis from the government about, redeployment or right to refuse unsafe work. There's all kinds of really specialized free education and supports for healthcare workers, links to them. We were thinking about, that peer mentor feature. There may be organizations that don't have that within their organization. So we have trained peer educators and peer mentors that we've trained through our Beyond Silence training. Could we offer that as an additional support that people could access? This feeling about being down and discouraged and tired, there's all kinds of really fantastic things on the web now around inspirational thank you messages to our healthcare workers. Could they click on that if they just need a little boost? We've been thinking about, how do we scale this up and make it available to people? And we've been looking for funding to facilitate free access. And so right now, what we said we're going to do is say, we have this app, it's there, it's developed. How do we make it free to everybody that wants it? So we're just going to figure out how to do that and say for the next 3 months, anybody can access it. It's going to be free. If you're an Ontario-based healthcare organization, we said Ontario. I think there was a question in the chat about Beyond Ontario, we said Ontario to begin with, just because some of the local resources and supports are Ontario-based. Do we set a priority for, I have a real passion around small under-resourced organizations. I've been looking at long-term care homes. How do we get this to them as one kind of tool in their toolbox? We don't know what our capacity is at this point. So we'll kind of just respond to questions as they come. I have no idea if people are going to be excited about this or not excited about this, so we're not really sure, but we want to put it out there and see. Again, if your organization, maybe you know of organizations that might be interested, really what we just ask for is there's some kind of champion that we would link with who would lead the implementation process. The other thing is just to put it out there. I know some of you have lots of really good wisdom already. If you are interested in developing content, these really short articles, or you have links or things that we should put on this app for healthcare workers, please send them to us. If you have ideas for funding to make this free in perpetuity, we'd be very open to that. I don't want to charge for the app. The costs really to us are around the technology, so hosting and technology software updates, some things around some of the admin pieces and maybe the peer mentorship support. So it's not a ton of money, but those are the actual costs to us. And so, yeah, so just contact us, let us know. And we'll do our best to respond. My contact email is also there for people that may want to talk to me directly, but otherwise we'll kind of go, and my email inbox is full, so you might be better with the Beyond Silence email there. And I will stop there.
Yeah, great. Thanks a lot, Sandra. It looks like a fantastic tool and hopefully of immediate use. Oh, I just lost the chat. There was a question about use outside of Canada or outside of Ontario.
Yeah, we haven't really thought beyond the next 3 weeks. We're just trying to get through the day, right? As opposed to something. So I think at this moment, our priority is Ontario and some of those small under-resourced organizations. Absolutely, there's, if we can meet the capacity and figure out how to scale it broadly, we'd be open to those ideas. We just wanted to do what we do well first before we kind of get too big too quickly, because we're a very small team.
Okay, great. That's fair. And there was another question about the cost, and I know, so it's free now. Is there a cost identified in future, or that's you're still hoping you don't have to get to those calculations?
My goal is to really figure out how to get research money and make it free. The other thing I didn't say is that there's an organizational code, but people that access the app, there's no identifying information. So we don't gather any information about who is using the app. So it's, again, completely anonymous.
That's important.
Did that answer the question? Sorry.
Yeah, no, I think it did. So here's a question for both you and John. Starting with an illustration of moral dilemmas frontline workers are exposed to. Is there a question in the survey to capture those dilemmas? And is there something in the app? It's a good question, Catherine. So she's saying that you both acknowledge that that's some of the stress is caused by these moral dilemmas. Are there any, does either the survey or the app sort of tease that out?
So I can respond a little bit to that first about the app. So at the same moment, I'm involved in a national project developing an app for public safety personnel, so first responders. And so we've been looking at the literature around moral injury. And I guess that it came from the paramedic about moral injury. I'm not sure if the language is as common in healthcare, but absolutely there's moral injury. So yes, I think we do need to include that because that's what we're hearing from the field. And, you know, I think about, you know, people trying to provide the best care they can, but they, you know, don't have enough equipment and they don't have enough supplies. And it's really heartbreaking. And how do we help people navigate that, or even understand and put words to what it is they're experiencing and maybe why they're struggling when they go home at night. So yes, I think from the app perspective, we do need to address that.
Okay.
Here,
yep.
To answer that question, some of the questions are set up about things that people are concerned about, especially the shortage of PPE and stuff like that. And then the correlation of those questions with the anxiety measures, etc., will give you some view. The other thing that we didn't talk about on the survey is that there are a lot of comments written in, and we have a qualitative researcher, Daryl Stevenson, who was looking at that. However, he and his partner just had a baby, and there are other things that, but the comments are a very rich resource for comments about those type of things.
And I can even see, as I was listening to your work, John, the amazing work that you're doing, you know, one of the things that we tried to do in the app, it has it be friendly, right? So, you know, some of the data that you're coming up with around, you know, the app doesn't provide PPE, which I really wish we did. But, you know, like knowing that this is kind of what people are struggling with, like we always try to put a little piece at the beginning around, you know, we hear you, you know, this is a really tough time. And, you know, not to really minimize the fact that this is a really tough time. And some of it's around supply that we don't have control over, right? But again, the app is around managing the anxiety and distress around that in a way that's meaningful enough. You know, there's not a lot you can do in an article on an app, but to acknowledge and support as best we can. And maybe there's some things from the quotes, I guess, is where I was going with you, John, around, you know, we could bring some of that in so it's relevant and authentic for them.
Well, there was one this morning that popped out at me as I was scaling through the data, and the respondent just said, please pray for us.
Well, we are hoping to have Daryl present later in this series on the value of the qualitative aspect of these surveys and the voice and the stories, and that they resonate and add more dimension to the problem, but also maybe some solutions too. So we can maybe even get Daryl to look at the data from the healthcare survey, although he has done analysis on our stress assess survey in the past. So, and his baby is only 1 week old today, so we can't necessarily expect too much, but we definitely will have a session on that over the course of the 4 weeks, I think. And there are some comments here. There's one that's kind of a technical question that I think I'll email to you, Sandra, about how to get the code if you're a trainer. And I think there's some comments around the sense of betrayal by those in authority is significant. And this comment about everything's getting blamed on community spread. In terms of workers, I presume that comment, Terry, is around that the infection rate in healthcare workers is being blamed on the grocery store and not the workplace, which is pretty disturbing too. So